In your morning medical news, the Trump administration abruptly halting all federal advisory committee meetings, including some at the National Institutes of Health. Those are the panels of experts who meet to advise the government on regulatory decisions. Some of the meetings are sessions where grant proposals for medical research are peer reviewed. Highly reviewed proposals then go to the National Institutes of Health to try to get funding. That process takes several months, so a small lapse wouldn't greatly impact the pipeline. A Health and Human Services spokesperson says it is so the new team can set up a process for review and prioritization. And ethics concerns are emerging as Robert Kennedy Jr. plans to keep profiting from drug company lawsuits, even if he's confirmed as health secretary. RFK Jr. has made $2.4 million referring clients to a law firm suing Merck over its HPV vaccine. While he'll give up cases involving the government, he will keep collecting fees from past private sector referrals, raising questions about conflicts as he'd oversee policies affecting the same drug makers. A Boston mother knows all too well how tiny NICU babies can be. They're so small that they don't fit into newborn clothing. That's why she started a donation program 5 years ago. And in that time, at least 5,000 preemie-sized gowns and onesies have been delivered to hospitals. Brianna Pitts has the story.
Pink is definitely her color.
Oh, yes. You're so beautiful.
This is little baby Ava. She's been in the NICU at Mount Auburn Hospital for a few weeks now. And that onesie she's wearing, it's from Megan, who knows the NICU all too well.
I know exactly how I felt, and I felt like it was for me.
Yep.
More than it was for the baby, more than it was for anybody else. It was for me.
Yeah, definitely.
Megan is talking about the birth of her daughter, Caroline, who was born prematurely at South Shore Hospital at 34 weeks. She weighed just 3 pounds, and like most families, Megan and her husband found themselves completely unprepared, without even one outfit that would fit their tiny daughter. That is, until a NICU nurse went above and beyond.
And come to find out, the nurse that was caring for her had actually purchased it with her own money. Seeing her in clothes made it like humanized her in some ways for me, and it was really, really healing.
That small act of kindness inspired Megan to start Caroline's Closet, an Amazon wish list with preemie-sized gowns and onesies. Each year, she calls on friends, family, and the community to donate. This year marks 5,000 onesies delivered to local NICUs.
Prior to Caroline's Closet coming in, is that something that nurses like yourself and others would be doing?
Yes.
It was?
Yeah.
And the program is expanding. Families at Mass General, Boston Medical Center, South Shore Hospital, and here at Mount Auburn all have access to outfits for tiny miracles like Ava.
So one challenge that we definitely face with clothing for the babies this little is the wires. It's really hard to dress them and find clothes that are adaptable for the accommodating the monitoring that we have here.
Megan knows this too, so she only brings gowns or onesies with snaps and double zippers. Teeny tiny pieces of fabric making a big difference.
Actually witness the impact of it, and it's powerful.
Yeah. It definitely is.
You can find the Caroline's Closet wish list on Amazon.